This presentation will give you a brief overview designed to complement your reading and module assignments, focusing on disorders that affect the bones, joints, and muscles, referred to as musculoskeletal disorders. Amputations simply refers to a loss of a limb. This could be present at birth or acquired, which refers to a loss after birth. The impact of the amputation on the individual's life covers a broad spectrum. This is impacted by the location and number of amputations, other medical conditions, and appropriateness of assistive devices. In addition, some people with amputations struggle with phantom pain sensations, infections, skin breakdowns, and deconditioning. Recreational therapy designs programs to assist individuals with amputations immediately after the injury, such as an inpatient rehabilitation setting, as well as outpatient rehab settings. RT often focuses on community reintegration, strength, endurance, problem solving, and adjustment issues. Individuals with amputations often benefit from leisure education, adapted sports, and creative or expressive arts programs. Arthritis refers to joint inflammation and is the #1 cause of disability in the United States. Osteoarthritis is a degenerative condition that results from the deterioration of cartilage, while rheumatoid arthritis attacks the joint's lining and is an autoimmune disorder. Like amputations, the impact on the individual with arthritis can vary from general joint stiffness to deformities, and these symptoms are often unpredictable and often invisible to others. Individuals with osteoarthritis will typically experience relief from activity and movement. However, this is not the case for rheumatoid arthritis. Recreational therapists need to understand how pain and temperatures can impact a person with arthritis, resulting in decreased activity, depression, and poor health. When pain is controlled, an individual with arthritis may be able to participate fully in leisure. RTs often focus treatment on exercise programs, such as range of motion and strengthening, as well as pain and stress management, and then self-regulation techniques. Individuals with arthritis often benefit from yoga, tai chi, aquatics, and leisure education. Muscular dystrophy is an inherited disorder that progressively weakens and causes the voluntary muscles to atrophy. There are several different types of muscular dystrophy. These are based on the age of symptom onset and the location of the symptoms. Muscular dystrophy itself is not fatal. However, its effects on the individual's cardiovascular and cardiac system can result in death. Initially, daily exercise can help to slow the impact of the disorder, but over time, assistive devices become necessary for mobility and communication. Cognitive impairments do not typically evolve in this disorder. However, emotional and psychological issues often emerge as physical limitations decrease and dependency increases. Recreational therapists often focus on improving the individuals with muscular dystrophy's quality of life, movement, and social interactions. Interventions might include leisure education, assistive devices, technology, and self-expression, such as journaling and creative expression. Osteoporosis refers to the loss of mineral content in one's bones, resulting in bone deterioration and loss of mass. This results in the bone becoming porous and brittle, resulting in an increased risk of fractures and compressions of the vertebrae. Osteoporosis is very prevalent worldwide and is considered a serious public health issue. It can be a secondary condition for other disorders you will learn about in this class, such as cerebral palsy and spinal cord injuries. due to excessive amounts of inactivity and bed rest that are associated with these disorders. The primary intervention for individuals with osteoporosis is exercise. Exercise, specifically weight-bearing ones, are known to promote bone health. In addition, recreational therapists may focus treatment on relaxation skills, leisure education, and fall prevention. Poliomyelitis, often referred to as polio, is an infection of the motor cells of the spinal cord, resulting in various degrees of paralysis, from temporary to permanent. Post-polio syndrome results when one overcompensates for the weakened muscles by overusing the undamaged muscles. Due to immunizations, polio has been virtually eliminated in industrialized countries. Typical symptoms include a high fever, severe weakness, pain, and progressive weakening of the muscles. In many cases, individuals with polio have remittent and reoccurring symptoms, impacting the person's mobility and independence. Recreational therapists need to take into consideration not only an individual's physical limitations, but the psychological effects this disorder has on the individual. Teaching these clients how to use adaptive equipment, temperature regulation, and life balance is essential to assist an individual living with polio. Interventions such as physical activity, aquatics, leisure education, and relaxation techniques can help them learn to live a happy, healthy leisure lifestyle. Spina bifida is a birth defect where the vertebral arches fail to close completely around the spinal cord. This resulting effect can range from difficulty walking to complicated physical impairments, such as paralysis, incontinence, and immobility. There are 4 different types, and the severity of this disorder is based on the location of the lesion. Children with the most severe form often experience hydrocephalopathy, which could result in intellectual impairments. In addition, individuals with spina bifida can have skin breakdown due to the lack of sensation to the lower limbs. RT professionals need to choose interventions that help the client to live a happy life while reducing the impact of the secondary conditions, such as obesity and depression, and to address trunk weakness and postural issues. Recreational therapy interventions might include equine-assisted therapy, adapted sports, community reintegration, and social engagement. Thermal injuries cover all types of burns, from fire to chemicals and electricity to radiation. It also covers conditions resulting from exposure to extremes in temperatures. The impact of the individual depends on the severity of the tissue damage sustained during the exposure, as well as the duration of tissue exposure. Burns are divided into 4 categories based on the depth of the tissue damage and are described by the percentage of total body surface involved. Medical attention is required for 3rd and 4th degree burns to address the possibility of shock, respiratory failure, and infection. As the skin heals, scar tissue can result in contractures and reduction in range of motion. Recreational therapy options include range of motion exercises, relaxation techniques, coping skills, community reintegration, self-esteem, and emotional regulation skills. Interventions should focus on self-esteem, independence, and physical activity. Taking in the disorders discussed in this presentation on musculoskeletal impairments, there are several things to consider when thinking about the assessment, planning, implementation, and evaluation (API) process. The World Health Organization International Classification of Functioning checklist helps to assess activities of daily living, and the Functional Independence Measure, and the WeFIM for children assesses functional levels on a scale from independence to complete dependence. Some contraindications for the disorders in this presentation include safety precautions associated with shunts, incontinence of the bladder, management of colostomies and other surgical openings, as well as considering the environmental temperature. Other contributing factors to consider are the psychosocial development of the individual, pain levels, mobility limitations, and the individual's equipment needs. It is important to have a thorough understanding of the considerations, contraindications, and contributing factors associated with each disorder to ensure safety during interventions. Make sure to fully understand the disorder you have chosen for your project, including an overall understanding of the medical condition and the factors that impact the individuals living with said condition.